Hello everyone, welcome to my show. This is Dr. Naina of NainaMD Beverly Hills. My show is Fusion of Science and Beauty, and as you know, I bring you the best of anti-aging and regenerative medicine. We know now that it's an evidence-based specialty and so much is happening. And today I've got a cutting-edge guest. He's so highly trained. He's one of the leading Beverly Hills dentists. His name is Dr. Jonathan Rudner. Hello, Jonathan. How are you?
I'm doing well, thanks.
Thank you for coming on my show. I wanted to get you for a long time, and I'm glad you were able to finally come.
Thank you. It's my pleasure to be here.
So, you know, anti-aging is the field's exploding. We have so much evidence-based now. And one of the things that always I get asked is that it's not just about putting in fillers when, as we age, some of the volume loss is due to just, you know, the aspect of aging and gravity, right? When the muscles start to sag. And we do things like dermal fillers, we do Botox, we do skin tightening, lasers, therapies, and so forth. But I think a very important aspect, and that's what I wanted the audience to really get educated about, is that there's anti-aging of the face through dentistry.
Yes,
correct?
yeah, there is.
So tell us about, because a lot of times I see a lot of the, like as we age, I see the receding of the jawline. And what can we do? Like how? And then I see these women, they have these amazing transformations. I look at these before and afters, and they're just phenomenal. I've seen them in your office, by the way.
No, thank you.
That's why you had to come on my show, because it was his office that I saw it. But what happens, and how do you fix it?
Yeah, you know, cosmetic dentistry. You know, a lot of people are scared of it sometimes, and there's really nothing to be scared about.
Well, you've been in the business over 10 years.
Yeah.
I mean, you're so experienced. What has changed? What is that? Has that changed, that concept?
It just, there's a whole just concept now of anti-aging, and a lot of what we do is, you know, just bringing back the smile, bringing back the youthfulness, and you know what happens is, as people age, a lot of things change. You know, you touched on it. The muscles change. The muscles start to sag in a little bit here, you know, in the cheek, the jawline, the lips start to fold in a little bit. And so what a lot of people don't realize is that teeth and helping the smile can fix all that. And you don't need, I mean, as an adjunct to fillers or Botox or some of these anti-aging procedures, teeth now play a huge part in just enabling you to rejuvenate the face, the smile. You know, we call them, you know, sometimes we call them a smile lift, you know, a gum lift, you know.
It's a smile lift. It's really, I think it's not only is it a smile lift, it's almost like a jaw lift.
And so what happens as, you know, as time goes on, you know, the muscles, you know, in the jaw here start to sink in. And as they start to sink in, what happens is it pushes the teeth. And what patients don't realize, as time goes on, these teeth start to sink in, mainly the back teeth. And if you've ever seen someone when they smile, and you can only see maybe their front, you know, 4 or 6 teeth, and then back here, it looks like they're missing teeth. What happens is the muscles over time have pushed them inside.
Tell me about the porcelains, because porcelains were like, okay, 10, 15, 20 years ago, right? People used to get veneers, and it was all the Hollywood celebs and everyone that would get the veneers. But it's changed. It's like now the porcelain looks almost like very alive look. I mean, it's like real.
And so that's what's going on now, is just 20, 30 years ago, people were doing these porcelain teeth, and you know, they're making them look brighter and whiter, but you know, they kind of just had what we call an opacity to them. They were just one color, and they weren't dynamic. But now it's just the technology.
Is it because just the way that they mix the porcelain?
Yeah, the way they mix the porcelain now, all the new types of porcelain, we can make them look so lifelike and just kind of match your face and just a lot of different characteristics. And so,
can you pick? So, in other words, you as a cosmetic dentist will also pick the kind of porcelain. Is that so to speak?
I mean, there's several different porcelains out there, but every patient's different, and it's tailor made to each patient. You know, each patient, you know, is not going to have the same type of porcelain. They're not going to have the same color porcelain. It really just depends, you know, when I have these conversations.
Where does your art come in? Where does your like because you're personalized, like what makes you, let's say, a little bit different from the guy next door?
I'm a, you know, highly aesthetic person, you know. I've always kind of taken care of myself, and so you know, that comes in into dentistry. You know, I like to make people look great.
You know what? I think it's just a question of really putting it all together. So for example, I want you to go back and talk about like what happens with giving the support for the smile, and then I know lips is a huge thing, right? Yeah. So first, tell us about the smile. How you're going to build the smile up.
So I mean, listen, everybody knows that the smile is the first thing. The first thing you see, you know, either looking at somebody's eyes or you're looking at their smile. You know, the confidence that people have when they go into an interview, when they go into, you know, just talking to somebody. You know, they're either holding, their hand over their mouth because they're upset about their smile or self-conscious. And so that's what we can do. We can rejuvenate, we can make it look better. And so what happens as time goes on, you know, a lot of the aging process happens. And so what happens is teeth start to get shorter. And
people grind. People grind too.
They grind their teeth. They start to get shorter, and they start to shift. And so what's happening is, like we mentioned earlier, it sinks in. And so what we need to do is we do porcelain veneers. And porcelain veneers is a non-invasive procedure.
Can you fix like an asymmetric smile?
Yeah, we can. We can make it all perfect. We can, you know, if somebody has, you know, maybe the midline is off, we can kind of put it right back to the middle. If one tooth is longer than the next, or one side is longer than the other side, we can make them all even. And so going back to building out your teeth here, what happens is it gets pushed. And so you want to now build the veneers back out here on the sides, and it will then fill the smile out. Okay, and so it also helps support and hold the muscles. Another thing you mentioned earlier is lip support.
Oh my gosh! Because women and men, we're all getting our lips sort of fillers, right? And the lips are more a sign of beauty is to have fuller lips. I mean, Angelina Jolie started that trend,
absolutely,
and it's never ended. But when you have that lip, it looks kind of funny because if you fill the lip, then you need the support, right? I would think.
And so that's that's a really big topic, and
what do you do? So what do you do?
So a lot of patients, as time goes on, you know, the lip sags or the lip gets hurt, and what happens is, you know, so you're doing fillers, you're doing, you know, Botox for the lip or the fillers, and what's happening is when you plump up those lips, you need the support. If you don't have the support of the teeth, what's going to happen is they're just going to sag again. And so a lot of patients now, it's kind of, you know, it's a multi-specialty or just kind of encompassing everything together. Is they're going to, you know, to you to get the fillers done, and they're coming to me to get the lip support. You know, putting the veneers on the teeth and just kind of building them out a little bit and holding that lip in place. Or else, you know, what's going to happen is all the fillers that you put on the top lip, they're just going to sag and sink. And so a lip support is a very big procedure.
And then what about? So we talked about the teeth going in, right? So you can fix that through the veneers, right? Yeah. We talked about the lip support. Is that also then just based on the veneers, the way the veneers are angled? Is that pretty much it?
It takes a lot of, it's all about facial symmetry too. You know, it's all about the patient and how much lip support we need. And, you know, it just depends on, you know, some patients come in and they get, you know, minor fillers done. And so, you know, we may have to do just, you know, a couple of, you know, maybe half millimeter more of lip support. Other patients want even more, you know, of a filler. And so you have to give a little more of lip support. And so every patient, you know.
And that's accomplished just through how you adjust the veneers. Is that right?
Veneers, yeah.
That's amazing. So, that is really amazing. So veneers obviously is huge. I mean, it's huge. Yeah. What about is there like that Invisalign? Like, do you use things if you have to go a little further than veneers to actually straighten the teeth? Is that the Invisalign? Because you remember the olden days, you had to have all this metal, and nobody wanted to like redo it, and then the teeth would still shift, and then you had to wear your like retainers and all that.
Right.
I mean, I went like years and years ago.
You know,
what's different about that in terms of anti-aging?
Now, you know, patients who are older, you don't want to put metal in their mouth. You know, you don't want to put braces in their mouth. You know, like we talked about, a smile is huge for your confidence, and so
you don't want to be seen with
So now there's the Invisalign, and Invisalign is like braces, and what it does is it shifts your teeth or moves your teeth into place, and you know, you don't have the metal anymore, and you wear these clear plastic trays. And
are they removable or they stay? They're removable.
They're removable. So the great part about them is that
cool
if you have an event to go to one evening, you just take them out. If you have a dinner meeting, you take them out. You know, when you get home that evening, you just pop them back in, you wear them, you know, and so it's really flexible in terms of patient's schedule. Listen, you're supposed to wear them all day, but, you know, you take them out to eat, you take them out for events, but that's the flexibility of them, you know, and then they're moving, and it's great.
And then as the teeth move, as you build up with the veneers and all of that, do the muscles change? Do the muscles get, I mean, how do I say that? Do the muscles like, when the muscles are moving alongside, they move in a different shapes and form. Does it last? How long do this whole procedure
so
last?
That's great. You know, like, okay, so, you know, if we build your smile out, right, what's happening over time is those muscles sag and they sink in. But if you build the smile out, that is another form of support that holds the muscles in place. And so now that they're not going anywhere, so that the muscles aren't sagging, you know, the lips aren't sagging anymore, the teeth are holding them in place.
Anti-aging. I mean,
and so, you know, this way you don't have to continually do the fillers, but you also the teeth help in a big way.
Wow. So tell me, like, how do you've got an amazing smile. What are you doing? And like, we got a couple of minutes before we take a break. What do you do to take care of yourself?
Yeah.
So what do you like? I want to know what you eat. Like, when you get up, what do you have for breakfast?
Well, obviously my teeth. You know, you can see. You know, I'm a cosmetic dentist, and so listen, you want to go to a dentist who looks presentable. You know,
you got to walk the talk, right?
I'm a cosmetic dentist.
My clients always say you got to walk the talk. They look for people who walk the talk.
You don't want to go to a dentist who has yellow teeth and crooked teeth and think that they're going to be able to. You know, give you the smile that you're looking for. And so I take care of myself.
Do you exercise?
Yeah, listen, every morning I wake up and I'm at the gym. You know, that is a routine, you know, every single morning.
How long do you work out?
I wake up, I go to the gym. I'm at the gym for an hour in the morning before work.
What do you do?
Yeah, just a lot of, you know, I do running, I do weights, you know, cycling, just kind of
keeping fit. Do you do any facial exercises?
Yeah.
Because that women are talking about you. So, you know, in anti-aging, we discuss this. Is there like, and the women will ask me a lot, are there any facial exercises I can do? And, you know, with the whole thing with microcurrent machines and all this, do you recommend facial exercise or really not necessary?
I mean, there's not much that we do. There's one thing that I can tell you that some women don't like, and which is a secret, is chewing gum. Believe it or not, chewing gum is not great for, depending on what you want to look in terms of your facial aesthetics, but women who chew gum or men who chew gum build extra muscle, and they build extra muscle here. And so, you know, here in Beverly Hills and in Hollywood, a lot of people don't want this extra muscles here. You know, they want that kind of chiseled look, that kind of in here. And so, you know, patients...
So don't chew gum.
Yeah, well, you know, gum is good in a lot of other aspects, of course. It helps in... you know, with fighting tooth decay and stuff like that.
But don't overdo it.
But don't overdo it, because if you build out these muscles, what happens is you push out, you know, the jawline, and it becomes a little thicker, and a lot of people don't like that.
That I did not know. That I did not know. And is there any, like, some women say you have to, like, tighten like the platysmus muscles and the relax them. That's once you provide all the veneers and all, you really don't need to do any of that, right?
The only other thing that we do now as dentists, or we refer to you, is a lot of Botox in the jaw. And those are patients who either grind their teeth a lot, or, you know, have a habit of chewing gum, or these facial muscles, these big muscles here. If you do Botox in those muscles, you calm those muscles down. And as time goes on, they start to shrink a little bit, and you don't get a lot of the grinding problems, and you don't get that look of this pushed out jaw.
Wow. That sounds really great. Listen, we're almost going to go to a break, and we're going to come back on another aspect of anti-aging and you know, porcelains and veneers and so forth, and that is fillings, right?
Yeah.
Everyone has fillings. So we'll be right back right after this break on NainaMD, Fusion of Science and Beauty. Hello everyone, welcome back to my show. This is Dr. NainaMD, Fusion of Science and Beauty, right here in Beverly Hills. I have a fantastic guest, Dr. Jonathan Rudner. He's been a leading Beverly Hills dentist probably one of the top, and giving us amazing information about anti-aging and cosmetic dentistry. We were continuing Dr. Jonathan Rudner about how the aging process, you can rejuvenate just through doing certain small procedures through the teeth. One of the things is it's like you probably need a basic canvas, meaning you need clean teeth before you start any work, right?
Yeah.
So have any advancements been made there in terms of cleaning the teeth, whitening the teeth? Tell us what the latest greatest is on that.
I mean,
because remember the old one was you had to like go days and days and weeks, and you had to like put the teeth in these plates, and then they used to I went through it, and then they used to hurt the gums and all that. Okay, give us some newer technologies.
Listen, it all starts with the health of your teeth. You can't do any cosmetic dentistry, whether it be veneers, teeth whitening, Invisalign, if you don't have healthy teeth. You really need healthy teeth and gums. Okay, so you have to get your cleanings done twice a year. You have to make sure the gums are maintained. You have to make sure you're doing your oral home care, flossing, brushing, those type of things. If a patient comes in and wants veneers and they're not taking care of their teeth, I just won't do it. I'll just have to say, you know what, go. You just can't get it done. If I do something, whether it be Invisalign or veneers, you're just not going to get a long-term effect. And so you really need health is first, and you really need to take care of your teeth. Brushing your teeth, flossing, that type of thing. And
how do you whiten?
Yeah, so whitening is great. Yes, back then you mentioned it. You used to have to put this gobbledygook in your trays, and you have to wear them all night, or have to wear them during the day, and then you'd wake up and it'd be everywhere, it'd be on your pillow, and you had to do it for 2-3 weeks in a row. Now you come into the office, it takes under an hour. Teeth are white right afterwards. We do it in the office, we do a laser teeth whitening, and when you leave the office, they're bright white.
Wow.
Yeah.
In 1 hour. Oh my gosh.
Yeah.
Okay, so what about the next thing is fillings, okay? A lot of people, for whatever reasons, they just don't want to do the metal fillings.
Yeah.
They just don't want to have metal fillings. I know some of the older fillings just have mercury. And even though, there's such a controversy about is it really good or is it really bad, forget that. They just don't want it.
Yeah.
Okay? So, and plus cosmetically, I think when you open up your mouth, it would look nicer to have something that's nice and white over metal, right?
Of course.
So, do you take out fillings, or are you finding that a trend is towards porcelain fillings?
Yeah, so I don't even.
Is that what they're called? Are they called porcelain fillings?
Composite fillings or porcelain fillings. It depends on the material you choose. But I don't even have metal in my office. I don't have metal fillings. We don't even do metal crowns, and that's something that I'll talk about afterwards. But going back to the mercury fillings, people, they open their mouth, they smile, they just don't want to see these black fillings in their mouth. Like it's unsightly.
I know I had mine taken all out and everything.
It's unsightly. It doesn't look youthful. It looks like you have a lot of history in your mouth, is the way we present it to patients. And so we remove these silver fillings. And what happens is over time, putting mercury aside, silver fillings are not good for your teeth. They start to crack. They start to crack your teeth, and you can get into future problems. And so when patients come in, we really kind of stress removing those silver fillings just for the health of the tooth, and and also just to take out the silver and make it look great, white and
really
pretty.
Nice. Yep.
Yeah.
What about and moving on then onto so now you've got like fillings that are amazing. As far as technology goes, you're whitening the teeth. Is there any advancements in just like any recommendations, just like toothpaste, like basic stuff, toothpaste and toothbrushes? There's like jillions kinds of toothbrushes. Okay, educate us on this one. This is like, I can't go to the store. I don't know what to pick up.
Listen, it all starts with brushing your teeth. As long as you're brushing your teeth a minimum of twice a day,
does it matter if you've got nylon bristles or all this kind of bristles?
The best is an electric toothbrush. There is a real, patients who come into my office and I kind of direct them towards using an electric toothbrush. I mean, they call me weeks later and just they feel the difference of how much cleaner an electric toothbrush will make your teeth. And so, and listen, there are a lot of like toothpastes out there and stuff. And so what patients don't realize is, toothpaste and whitening can't fix it all. It starts with what you put in your body, So a lot of patients drink coffee, tea,
everything that's going to
red
stain
wine,
the teeth, right?
those type of
things are going to stain
I'm not
the
saying
teeth.
don't drink those things, but you know, you have to kind of be conscious of it. You know, if you're sitting at your desk with a cup of coffee for 3 hours, you know, you're coating your teeth with
Constantly
staining
sipping
materials,
it, right?
and so you know your teeth are going to become yellow, you know, and so they're going to become brown, and so you know we always suggest, you know, you drink a coffee, maybe drink it with some milk, that helps, or drink a coffee and right afterwards have a glass of water and swish it around so you kind of move around. Or the best case scenario is you have a cup of coffee and you have a toothbrush hidden in your in your desk, and you know you brush it and stuff like that. You know, just to kind of maintain you know the look and the whiteness of your teeth. And so
what is there any kind of like any nutrients, like do you like recommend any certain nutrients that are good for teeth that you just know of, or any healthy foods or anything, any hints that you can give us in terms of that?
I mean, we know what the unhealthy foods are, and that would be like sugars
Sugar,
and
right?
carbohydrates. You
Which
know,
is what
sugars and carbohydrates just feed the bacteria in your mouth that cause tooth decay and cause it to release acid. So you know, listen, you know, milk products are good. They're you know they're have a basic property, and so that controls a lot of the you know acid from the bacteria.
Is that the probiotics? Are probiotics good or no?
Probiotics are good for stomach.
Yeah,
and
not
so,
for teeth though, right?
not
Because
so
I know
much
all
for
of
teeth.
this stuff, right?
Yeah,
Okay.
yeah. And so you know, just keeping them clean.
Okay.
Flossing
And what about like in terms of is there certain things that you should like? Do you recommend like a set amount of time when you should not have any foods, just to give the teeth, you know, just like a break, so to speak, like rather than all the time? Like people just tend to eat all day long, right? Is that impact the health of the teeth? Not really.
Yeah,
right?
none at all. I mean, listen, if you're going to sleep at night and you have a full meal and don't brush your teeth, that's not a good idea.
Just as long as they're clean.
Yeah, you can eat
as long as they're clean.
Yeah, you can eat all day as long as you're keeping.
And what about the fluoride issue?
Yeah.
There's like so many people who are like saying, do your fluoride, don't do fluoride. And I know that the Dental Association is evaluating that all the time. There's fluoride is sometimes belongs to the same family where it's its highest affinity with where the iodine and the fluoride is. Tell me, what do you feel about where's the position? Tell me your personal position, and tell me where the Dental Association position is, because sometimes a lot of dentists that I've asked have two different positions. They say, look, it's this is what's recommended universally, but this is my opinion, which I'm entitled to, and this is what I would do, right? Yeah. So tell me about.
So again, that's another one of those things that the controversy is, you know, whether it's fluoride good or bad for you, you know. And again, studies have shown that, you know, fluoride for you in the health of your body, there's no effect. Fluoride is great for your teeth, and so my stance on it is I advocate for fluoride. You know, patients ask me, you know, what kind of toothpaste should I use? You know, should I use like a non-fluoridated toothpaste? And fluoride helps your teeth. I've been in practice for 10 years now, and I can see patients and what happens, you know, when you don't use fluoride, and so it really protects the teeth. Yeah.
Okay. And so we have to go back. You told us what you exercise. What do you eat?
What do I eat?
We need to know.
Yeah.
So when you get up, what do you eat?
Listen, you know, you want to take care of yourself, and
so what do you do?
So I wake up, I go to the gym, and after the gym, I have a protein shake. Lots of fruits in there.
Okay.
Some protein. Just to kind of get me started for the day. The fruits have a lot of water in it, so it hydrates me.
What are kind of like the fruits you put?
Oh, we do strawberries, and watermelon, and you name it.
Okay, whatever's available.
Yeah, whatever. We throw it all in.
Yeah, throw it all in. Okay.
But the protein is what helps the muscles and stuff like that. And then just kind of I work hard during the course of the day. I'd have to have lunch.
Yeah.
I just
what's lunch?
High protein lunch. Chicken, rice, salmon.
Okay.
Those type of things.
Okay. Then come dinner.
And then dinner. Same thing. I love a lot of chicken, a lot of fish. I'm a big red meat eater, and so I like red meat, and so
do you snack in between?
I don't. I just don't have time.
Okay.
Yeah.
And then what about do you take an occasional dessert? Anything to do it? Do you have like a sweet tooth?
I am a dentist with the biggest sweet tooth.
Awesome. It's good to know. See, confession time.
You will you will always find me after every meal having some sort of, whether it be chocolate, cookie.
Yeah.
I have a big sweet tooth. But you know what? I work out and I exercise to eat what I like.
Yeah.
And so the thing about it is a lot of patients tell me like, well, you eat so much sugar, but what about your teeth? And I listen, I eat sugar, but I'll brush my teeth afterwards.
Yeah.
Or I'll eat a lot of cake at night, I'll brush my teeth afterwards, and that's it.
Yeah, because a lot of people, they either forget or they get too tired, and then they just go to bed, right?
Yeah.
After then they don't brush their teeth. In fact, are there any statistics out on people brushing their teeth once a day, twice a day, 3 times a day? I don't know. Do you know?
Everybody's different. Like the recommended is twice a day.
Yeah.
You know, morning and evening.
But I know that when I've asked personal habits, I know a lot of people will just say, just because of their lifestyle, they're just doing it once a day.
Yeah,
and that's not going to work.
Not good enough.
It's not going to work good enough. Absolutely.
I have a lot of patients who come in and like I wake up and I brush my teeth and that's it. And I'm like, you don't brush your teeth at night before you go to sleep? I mean, if anything, if you were going to do once a day, do at night. Because you have all that food and all those
toxins,
everything that kind of you put in your mouth that you want to get rid of before you go to sleep and not kind of coat your teeth in. So ideally you want to do twice a day.
And how much water do you drink?
I'm constantly kind of drinking water throughout the course of the day. I don't really measure how many ounces. I have, one of those bottled water machines in my office, and so,
Fabulous. Listen, how do people look you up? What's the website?
Rudner, DDS.com.
Okay, it's Rudner, RUDNER, DDS.com.
Yeah.
You guys can hit me up at NainaMD.com. I'll tell you all about him. He's an amazing dentist. I especially picked him to come on the show because he's really knowledgeable and he walks the talk. I think that's very important. And also, you should see the work of the veneers that he does. It's a very personalized thing, and you do fabulous work.
Thank you so much.
Thank you so much for coming on the show.
Thanks
again. This is NainaMD, Fusion of Science and Beauty, right here in Beverly Hills. We'll be back next week with another great show. Thanks, everyone.